Well, now to a Sunrise Health report. Major changes are taking place across the country, making the diagnosis and treatment of ADHD more accessible, with significant new investment in our GPs, making it easier for them to diagnose the condition.
While the move is being welcomed by medical experts, some doctors are sounding the alarm, saying it could lead to unsafe use of certain medications. For more, we're joined by Dr. Anita Munoz, general practitioner from the Royal College of GPs, live in Melbourne. Great to have you with us. So, firstly, do you think it's good that we're making it easier for GPs to treat ADHD?
Yeah, so we are making it easier, but within Victoria, certainly, we are going to create a framework for GPs to be trained. So we recognise that the diagnosis of ADHD isn't simple. It takes time and it requires a thorough assessment. And so we will be putting in place a framework for GPs to undertake the training to do that appropriately. And we will also be undertaking training so that GPs can continue to prescribe when they're co-managing with a psychiatrist colleague. So this will make it easier. There will be moves to make this more accessible and more equitable across the state of Victoria, but we're certainly going to be putting a framework in place because we recognise that this needs to be done well if it's to be done safely.
Okay, because talking nationally, the rules we understand are different in each state. Doctors in some states can actually diagnose, others can only treat. Should we all have a national approach?
Look, I think harmonisation would be a fantastic thing for doctors and patients alike, and it is a bit frustrating that in our federated system a patient can have a totally different health journey depending on what state that they're in. But I can say, speaking particularly about my Queensland colleagues, that although the government in Queensland has not mandated the training, certainly GPs take their role very seriously, and they are doing the training regardless of the fact that it's not a mandatory requirement. And I know that the faculty in Queensland has just trained its 500th GP. So certainly the GPs are professional about this and they seek education, as is their duty of care when they're undertaking a new pursuit in medicine.
There's certainly a need for change. It can take up to a year to get an appointment with a psychiatrist alone. But GPs, we also hear that they're constantly pressured for time and to see new patients, etc. Do they have time, one, to get trained for this, and then two, to have that a part of their regular day?
Yeah, I think it's a great question. We know that, for example, if you're a hospital doctor, the state pays you to be away from work and pays you to do training to update your skills. And of course, GPs don't have that privilege. But I am very pleased to see that the governments around the country are recognising that they need to help GPs to undertake the training. And so they are funding GPs to do this training. And also we know that we're going to have to set time aside to do these assessments properly. So as I've been saying all along, I don't see that it's going to be possible for GPs to do very long consults only on what's available with Medicare funding. We know that Medicare funding that's on offer from the federal government is actually woefully inadequate when it comes to taking a good amount of time with patients. So I certainly expect that GPs offering this service will bring the cost down significantly for patients from the dizzying heights that we've seen up until now with very expensive assessments. But I also would let the community know that with what Medicare funds GPs in terms of spending long amounts of time with patients, which is what is required to do this properly, I can't see that that Medicare will cover the cost of it entirely. So there will be some tension there, but I think that seeing a GP all around the country, especially in rural and remote areas, this will really mean that people have greater access to really important treatment.
Okay, this affects a lot of families. Tell us what you think. Thank you very much for your time.